10, 15%, 27%. Hi, welcome. Good morning, good afternoon, and good evening. My name is Kathy Flork, and I'm the Head of Engagement Strategy and Global Development Operations here at Bristol Myers Squibb, and I'll be serving as one of your moderators for the summit. It's an honor for me to introduce our first patient keynote speaker for today, MarlaJan Wexler. She'll be speaking to us about the importance of frequent communication between participants and providers throughout clinical trials. MarlaJan is the CEO and founder of Fupus, as well as a pediatric nurse with over 15 years of experience. MarlaJan was born with a complex congenital heart disease and went from pediatric cardiac ICU patient to pediatric cardiac ICU nurse until a systemic lupus diagnosis forced her to put her career on hold. Since 2008, she's been diagnosed and treated for multiple autoimmune conditions, PTSD, cervical cancer, and underwent a double mastectomy in 2014. In 2012, MarlaJan created the blog Fupus, and in 2016, started Fupus LLC. Known for her pithiness, humor, and passion, MarlaJan has used her blog as a platform to become a patient advocate and influencer. She travels the country, sharing her story in hopes of bridging the gap between patients and industry. Before I turn it over to MarlaJan, I'd like to remind everyone to feel free to use the chat feature to ask any questions you may have for her that we hopefully will have a bit of time at the end. MarlaJan?
Well, thank you, Kathy. Good morning, everyone. It is a lovely Monday morning here in my basement in Philadelphia. I was at this event last year as a spectator, and I was beyond thrilled when Doug asked me to be a speaker this year in 2020. So thank you, Doug. Sorry, a little technical issue. Thank you, Doug, for allowing me to be here. I have to admit, I do miss the conference environment, the networking, the swag, the free cocktail hour at the end. I'm kidding. It's things that we can't all be physically together, but as an immunosuppressed individual, I'm grateful that virtual conferences are occurring so we can all be safe. And come on, ladies, it's incredible to not have to wear Spanx for 10 plus hours. Am I right? I may look professional on top, but I can't lie. I'm wearing some cozy sweatpants, and it is glorious. All right, so Kathy did a great job introducing me, but before I go on more, my name is MarlaJan Wexler, and I am a 39-year-old pediatric cardiac nurse, professional patient, and patient advocate. Aside from my nursing position at the Children's Hospital of Philadelphia, excuse me, I am an advocate for patients all across the globe, as I too live with multiple chronic conditions. In my 39 years, I've been diagnosed with tetralogy of Fallot with pulmonary atresia, which is a complex congenital heart defect, systemic lupus, Behçet's disease, Sjogren's syndrome, ITP, breast cancer, depression, anxiety, chronotropic incompetence, complex PTSD due to medical trauma. I've dabbled in cervical cancer, and I'm sure there's a few on the list that I'm missing. My fiance calls me a show-off. Hey, who's back there? After my lupus diagnosis in 2008, I started my blog, Fupus, really as a means to vent about the frustrations of the long-term and day-to-day struggles of living with several chronic illnesses. Over the years, it grew traction, and I started getting invited to speak at conferences like these, to share my story. And well, damn, who knew that people actually wanted to hear what I have to say? If I seem a bit fatigued, or you've met me in the past and feel like I'm not my usual spark plug self, it's because I had heart surgery 5 days ago. And here comes a cameo from Professor Puddin' Pop. My apologies. And I'm sure you're all wondering, how the heck did this woman have heart surgery 5 days ago? And yet she's out of the hospital. She's well enough to speak at 9:30 in the morning on a Monday. Is she Wonder Woman? Well, yes, I am. But the real reason I'm able to be presenting to you 5 days after heart surgery is because of a clinical trial. I mentioned that I was born with a complex congenital heart defect, tetralogy of flow with pulmonary atresia, a rare condition comprised of 4 defects that affect the structure of the heart and allows oxygen-poor blood to flow out of the heart and to the rest of the body. Basically, I was a human Smurf. Blue, blue, blue. While there is no cure for any congenital heart disease, I've had 4 open heart surgeries by the time I was 6 to repair the defects. Because I was born without a pulmonary valve, the valve that routes oxygen-poor blood through the pulmonary arteries to my lungs, I have wide open pulmonary regurgitation. Every time my heart muscle squeezes blood through the valves, about 60% of the blood flows right back into my ventricle. I've lived like this for 39 years. My body adapted over time to the lack of blood getting to my lungs. I always knew there was a pulmonary valve replacement in my future, and it's always been a matter of when and not if. Over the past year, my cardiac symptoms have gotten progressively worse. I could no longer carry a laundry basket up a flight of stairs. I had no energy. I got short of breath brushing my teeth. I'm not kidding. And my lips turned blue with exertion. I'm telling you, nothing says newlywed bliss engaged bliss. I'm not married yet, but nothing says that when you have to tell your partner, no, I'm fine, keep going, as your lips are turning blue. So when my cardiologist walked into the exam room mid-July at my 6-month follow-up, she said, "Girl, you effing failed your testing. It's time for a valve." I wasn't surprised in the least, but shocked just the same. I go into every cardiology appointment with the what ifs roaring through my brain. And while I love her for her no nonsense, getting straight to the point with me, because if you could obviously tell, I don't do sugarcoating, it still took a bit of time to process. I immediately told her, the CT surgeon, I wanted to do the valve replacement, which are the perks of working at the hospital where you receive your cardiac care. And she stopped me and said that she wanted me to be screened for 2 clinical trials, where artificial pulmonary valves are being placed into native right ventricular outflow tracts via cardiac catheterization. Why did I pick all these words at 9 in the morning? It was a long shot. My specific anatomy has kept me from being a candidate for transcatheter valve replacement in the past. But these 2 trials were specifically for patients with native right ventricular outflow tracts. If I could avoid a 5th open heart surgery, I was certainly ready and willing to be screened for these trials. I mean, can I get an amen? Come on, no open heart surgery? The next day, I reached out to the physician I work with, who is the principal investigator for both clinical trials. And within 40 minutes, he called me and we had an hour-long conversation about the trials. That same day, his study coordinator called me to set up the screening chest CT that was required. The reports and imaging would be sent to the screening committees, and I was told it would be about 4 to 6 weeks before I heard a decision. 2 weeks after the CT scan, I got a call from the PI's nurse practitioner that it looked like I may be a candidate for both trials and that the doctor was having 3D models of my right ventricular outflow tract made so he could put valves in and see what would be the best fit. Science is amazing. Another 2.5 weeks pass, and on September 4th, I get a call. It's the study coordinator telling me I'm on the schedule for the 16th. Wait, I was accepted into the trial? And which one? Yes, he didn't call you and tell you? Nope, sure didn't. Yes, you were actually accepted into both trials, but he wants to go with the 22 millimeter Medtronic Harmony valve, as your outflow tract is extremely narrowed and he felt the others would be too big. And so we have you scheduled for the 16th. The 16th of November? December? Nope, 16th of September. Oh, right, so in 12 days. Wait, I worked that day. We went through the logistics and she was keeping me on the schedule, but I certainly did not have to have it done on the 16th if I chose not to. Cue the panicked email to my primary cardiologist. This is too fast. How could they have not updated me sooner? The communication had been impeccable up until this point, and now I have to wrap my poorly oxygenated brain around the fact that I have 12 days to prepare. My fiance and I had just bought a house. Hell, we had just gotten engaged. Welcome to the world of MJ. Excitement just around every corner. It was all extremely unsettling to me. How could no one have reached out to me sooner? Would this have happened if I was a pediatric patient and they had to deal with the parents? Did they think that I'd be all hunky-dory because I work with this doctor almost every day? Is that an excuse? How the hell am I going to get ready in 12 days? I work that day. All right, so somehow it all came together in 12 days. My boss let me take that day off, and luckily a few more. And I had extensive conversation with the physician who's the principal investigator, airing my grievances at the lapse in proper communication. I told him that he and I both knew that this would not fly if I were a pediatric patient, and that even though we are colleagues, I wanted him to treat me as a patient first. He listened. We had great dialogue, and if nothing else, I know he took away how imperative effective communication is with all his patients. And let's be real, everything went well. I'm sitting here speaking to all of you 5 days after heart surgery with a fully functioning pulmonary valve that has no evidence of pulmonary regurgitation. I burst into tears when I saw that post-valve imaging, and I'm grateful for this new outlook on life. Sorry. My oxygen saturations are now 99% on room air. I'm not even wearing lipstick to show off my pretty pink lips. A far cry from how I looked just 1 week ago. But what happens when poor communication leads to poor outcomes? My father was diagnosed with chronic lymphocytic leukemia in 1992 when he was 51 years old. He was told his life expectancy was about 10 years. 26 years and just 3 separate rounds of chemotherapy later, at a 3-month follow-up, his counts were the highest they'd ever been, despite being on ibrutinib, a BTK inhibitor which showed significant clinical activity in chronic lymphocytic leukemia. After just a few short months on the drug, he became resistant. My dad was 75, and although not a spring chicken, was a generally healthy man. He ate well, exercised several times a week, and was even on a softball league throughout his 70s, even though he had been living with cancer for the last 26 years. When the doctors discussed with him that it looked like he would have to undergo standard chemotherapy for a 4th time, he was particularly adamant that he didn't want to do that. My mom, sister, and I were fairly distraught. He had done so well in the past with his last 3 rounds of chemo, and we thought the 4th time around would be a breeze. But at 75 and still working full-time as an aerospace engineer, we still knew he called the shots when it came to his medical treatments. Randomly, one night flipping channels on TV, my dad landed on a documentary that claimed, "Did we cure cancer?" Now, my dad is a huge science nerd, seriously. He used to read my physics textbooks for fun when I was in high school and college, so he watched intently. And in that documentary, my father was introduced to Dr. Carl June, the pioneer of CAR T-cell therapy for the treatment of relapsed refractory chronic lymphocytic leukemia. Not only did the first patient who received CAR T-cells have CLL, but the treatment was at the hospital of the University of Pennsylvania, 20 minutes from my parents' house. Dr. June was literally in their backyard, or across the river, as the case may be. But my dad got contact numbers online, and the next day he called to get more information on the trial. I'll be honest, I wasn't a big part of his screening and enrollment process, but my mom was by his side. Throughout the screening process, I know that my father spent every spare second he had researching CAR T-cell therapy. My father loved learning anything about everything, soaking up newfound knowledge like a sponge. He was fascinated with the complexities of immunotherapy. And I'm not even kidding. It was like a kid in a candy store at the excitement at the thought of being a part of something so monumental in the fight against cancer. We found out midsummer of 2017 that he was accepted into the trial, and in early September, he was starting the first step of the process, collection of his autologous T cells, where they're isolated via leukocytophoresis and then frozen. That morning, my mom, my dad, and I were at the Hospital University of Pennsylvania before the collection. He was supposed to get a double lumen IJ Medcom catheter placed in interventional radiology. He followed all the instructions he was given the night before, and he was cranky as hell because he wasn't allowed to eat. After the line was placed up in the apheresis unit, his nurse came by and asked questions. When was the last time you ate? Midnight. Last time you had anything to drink? 6 a.m. with my morning medications. She flips through papers. Wait, you took your amlodipine? Paul, we told you not to. But wait, the woman who called last night to give me my arrival time said it was okay to take everything. Oh, Paul, she doesn't know. Don't you remember we specifically told you not to take your amlodipine because it can make your blood pressure drop while you're on the apheresis circuit? 6 weeks had passed since he was specifically not told not to take the amlodipine prior to apheresis. 6 weeks. No one thought to call, text, email, no reminder letter in the mail, nothing. The nurse paged the physician, and 2 doctors came in and blamed my father for holding up the process. How did he not remember? It was his fault. They berated him while he sat in a hospital bed with a garden hose coming out of his neck. Now, while I had clenched fists and was ready to throw down, my father was beside himself. He truly felt like he was at fault, that he let his doctors down, and he was so upset that he held up the process. And we went home, my poor dad, with the double lumen IJ Medcom catheter hanging out of his neck. There's nothing like going home with a direct portal of entry for viruses and bacteria in a man whose immune system was about to be wiped out and basically reprogrammed. Nah, no risk for infection there. He went back for the leukocytophoresis 2 days later. And guess what? Not a call, a text, email, anything. Nothing reminding him to take his amlodipine. But luckily, he remembered not to take it. My father was infused with the manufactured T cells on October 26th, 2017. And less than 24 hours later, he was admitted to the hospital. The last time I had a conversation with my father was Sunday, October 29th, while we watched the Eagles beat the 49ers from his hospital room. Go Eagles! Except not this year. That night was the last time we saw him conscious, the last time we heard him say, I love you. Of the 19 patients enrolled in the trial, 1 patient died. My father. Watching him go through severe cytokine release syndrome was more horrifying than any horror movie I'd ever seen. No one had conversations with us to give us some idea of what we would witness. And to be fair, I'm not sure any conversation could have come close to preparing us, but some inkling of what to expect would have been greatly appreciated. The last day I saw him conscious, he had high fevers, was a little confused at times, but we had plenty of great lucid conversation. Along with the 106 temperature came rigors like I've never seen in my years as a nurse. In an attempt to lower his fever, the nurse had ice packs placed under both arms and around his neck, even though his body shook and his teeth chattered. I remember being troubled by what I saw, but thought, if this was the worst of it, then we'd get through it. I didn't have a goddamn clue. Over those next 8 days, we witnessed my dad hallucinate to the point of practically levitating out of his bed. He'd scream, he'd cry, his arms would flail in the air, and he'd speak incoherently. When his major organs began failing one by one, he was intubated, sedated, paralyzed, on multiple pressors, and there was discussions of starting continuous dialysis. He developed pneumonia, 2 brain bleeds, pseudomonas, cardiac arrhythmias, sepsis, acute kidney injury, pulmonary embolisms, and disseminated intravascular coagulation, leading to him getting 9 units of packed red blood cells, 2 units of platelets, cryo, and clotting factors in one night. We begged for answers. You didn't tell us it would be anything like this. Why did no one prepare us? Is he going to die? I can remember on 3 separate occasions, the doctor sitting down with my mom, placing his hand on hers and looking her in the eye. Olga, he is not going to die. This is severe cytokine release syndrome. He will get through it. He will not die. Maybe because no other patient had died up to that point, he truly believed my father would not die. I didn't get to the hospital room to say goodbye to my father. He died before I got to the room. It's a bit fuzzy, but I know I screamed at the doctor practically in his face as my boyfriend tried to pull me back. You told us he wouldn't die. You told us and you told us and you told us and you told us he wasn't going to die. Sorry. He tried to talk to me, but it was too little too late. I wasn't having it. Therapeutic communication is nursing 101. Pretty much the first lesson you have at the start of your nursing education. You never give patients and their families false hope. Do not give patients and their families false hope. Because when you do, something catastrophic happens. Though those 8 days were torturous in the ICU, the principal investigator did not come down to see my father or to speak with us once. When a patient is on their deathbed from one of your clinical trials, shouldn't you show some human decency and speak to the family? Actually, screw human decency. It is your responsibility as the principal investigator. Sponsors, hold your PIs accountable. We left the hospital distraught, heartbroken, confused, and angry. This wasn't supposed to happen. They told us it wasn't going to happen. And it happened. Words matter. Speak to your patients and their families, as communication is crucial the second a possible subject shows interest in your study. We have so much work to do before we develop the perfect clinical trial. But please, if you take away one lesson from my talk, it is that it is imperative to communicate. In my opinion, there is no such thing as too much communication between the medical team and the patient and their caretakers. Effective communication is the difference between a quick reminder text to not take your amlodipine the night before apheresis, or having to go home with a garden hose coming out of your neck. It's having more than 10, 12 days to prepare for heart surgery. And most importantly, it's being told that your husband is not going to die versus being rational and honest with the family. Thank you.
Thank you, MarlaJan. And I know there are a lot of comments in the chat feature. I don't know if you've been able to see those. Well, please do look at those. A lot of hugs and some caring words from our attendees. But really, thanks for sharing your incredible story and your journey as not just a clinical trial patient, but as a caregiver for your father. Your perspective on the importance of patient-physician communication truly hits home. And after all that you've endured, your bright outlook and disposition are really inspirational. So really appreciate that. I don't know if we have any questions on the chat, or anybody has any questions.
Yeah, there you
we have about 4 minutes. So we'll just give it a second and see if anybody has any questions.
Hi.
Don't know if the cat has a few questions.
Probably does. When will you feed me is his question.
So I don't see any questions coming through, but again, lots of thanks and thank you so much, MarlaJan, for taking the time. I just met you this morning, and it's been a huge pleasure, and your candor, openness, transparency with us for sharing your story has been just incredible.
Oh, thank you. Thank you so much.
So our next session, just so that everyone knows, will be a presentation by David Leventhal, Senior Director from Pfizer on patient in clinical trials, and that will begin promptly at 10 a.m. So thanks, everybody.
Dave Fuhrer, my cat's name is Professor Pudding Pop.
Thank you, MarlaJan.
Thank you so much. Thank you for letting me be here.
Take care.
All right, bye.
Hey, stop. Are you on?
I don't know. I should probably stop the broadcast.